I am Sarah Gallant, the speech-language pathologist here in the ALS clinic, and I want to talk with you about dysphagia. Dysphagia is the medical term for difficulty swallowing. It's defined as difficulty bringing food or drink to your mouth, difficulty chewing, or having trouble moving food through your mouth or down through your throat. Common signs of dysphagia include coughing frequently, choking, throat clearing, so after you swallow, some significant weight loss, feeling tired or getting fatigued with chewing, or being diagnosed with a respiratory infection or pneumonia. Usually in a diagnosis of ALS, fatigue with chewing or needing to take multiple swallows in order to clear liquid or food are the first signs of dysphagia. When you experience these signs at all, it's important to eat softer foods that require less chewing. It is also helpful to have smaller, more frequent meals to help reduce the duration of your meal so that that onset of fatigue is less common. Foods that tend to be harder to swallow are dry, crunchy foods. These require a lot of coordination in terms of breaking up all the little pieces and then also collecting them and molding them back together in order to swallow cohesively. Many times with dry, crunchy foods, as you swallow them, little bits will not go down altogether and tend to trigger a cough or choke response. Mixed consistencies can also be difficult. So a mixed consistency is something that has both a thin liquid component to it and a solid component. Some examples of that would be cold cereal with milk, chicken noodle soup, or a very juicy piece of fruit, like maybe a very juicy apple where you're chewing it, but the juice is also coming out as you're chewing it. Breads and starchy foods also can be challenging. So an example would be mashed potatoes without gravy. It's going to be sticky, or dry pasta. Things that are starchy tend to be problematic because as you chew them, they actually get stickier, whereas most foods, as you're chewing them, will get softer and easier to break down. Foods that tend to be easier are soft foods. So examples of these would be macaroni and cheese, a hot breakfast cereal, steamed carrots, or scrambled eggs. On top of foods that are soft, high moisture foods will also be easier to chew and also move through your throat more easily. So sometimes scrambled eggs, even though they're soft, can be dry. So you can make them more moist by maybe adding extra butter or extra cream to make them easier to move down through your throat. Other examples of high moisture foods are applesauce, yogurt, pudding, sherbet, or a milkshake. Liquids also pose some of their own challenges. So thin liquids move quickly through a person's mouth and throat, which can make them easy to get down the wrong pipe. You've probably experienced that sensation at some point. So a thin liquid, because it moves so rapidly, can sometimes sneak down into your airway before you are ready to swallow. Many times people will then suggest thickening your liquid. I would encourage you just to be cautious with adding a thickener to your liquid because sometimes the thickener itself can make the liquid stickier and more challenging to swallow. So instead of adding a thickener, it may be helpful to consider liquids that are naturally thick, such as fruit nectars. Jumex, Goya, and Kern's are brands that have a naturally thick fruit nectar. V8 juice is also naturally thick, although be careful with V8, it is high in sodium, so it wouldn't necessarily function for hydration. And also yogurt-based smoothies. If you're blending a smoothie at home, adding some yogurt to it can also help to naturally thicken it. Sometimes it's just a matter of using a tool to help make drinking liquids easier. Two tools that we really recommend are Nosy cups and one-way straws. Nosy cups have an indentation on one side of the rim, and that indentation fits around your nose. So as you're drinking a liquid, you can tip the cup up without needing to tip your head back. It is better to keep your head in a neutral or almost downward position as you're drinking liquids. And you can maintain that position with a Nosy cup by just tipping the cup up without your nose getting in the way of the rim of the cup. One-way straws are also helpful. Straws many times can make swallowing a little bit easier, especially if you're using a downward chin position as you're swallowing. But straws can also become challenging in order to maintain the pressure that you need in order to suck the liquid through the straw. So a one-way straw helps to minimize the need for pressure through the straw to get the liquid to come out of the top of it. Swallowing pills can also be a challenge. The safest strategy for swallowing pills is to place a single pill in a spoonful of a pureed texture, such as applesauce, yogurt, or pudding. The idea is the pill then is submerged in the pureed texture, and you can swallow the whole thing down as one good swallow, rather than with water. A pill and water move at very different speeds, and a lot of times lead to that sensation of the pill getting stuck somewhere in your throat rather than going down efficiently. Sometimes large pills can be cut into smaller pieces, or they can be crushed, but please check with your pharmacist to make sure that your medication can be cut or crushed before doing so. When swallowing becomes too hard, if you are experiencing significant weight loss, or you've had multiple choking episodes, you cough frequently and feel as though you cannot catch your breath during that coughing episode, or if the enjoyment of eating has simply gone away, you may want to consider the placement of a feeding tube. A feeding tube can provide the nutrients you need without the worry of coughing or choking. Keep in mind, you still can have small amounts of food by mouth that you enjoy. More about a feeding tube will be provided in a different presentation. Please talk with your speech-language pathologist if you have any questions regarding swallow concerns or swallow safety. We are happy to provide any recommendations for modifying food textures or strategies for drinking liquids, and we are also here to help provide support for the process of getting a feeding tube if you decide to go that route.